Welcome back. This is Dr. Jin Sung, and today's episode will be the brain and the evils of sugar. So how does sugar affect the brain is the question, right? So last week we talked about Alzheimer's disease, dementia, post-concussion syndrome, and the use of ketogenic diets. So use of fats to fuel the body and the brain. Because essentially what happens is, over time, if you take in too much sugar, your cells in the body become resistant to the insulin, right? So it's not able to take the sugar back into the cells, and you have more circulating sugar within the blood. And this can create a lot of damage in terms of the microvascular structure of your body. So those diabetics tend to get those sores in their feet or fungal infections on their toes. They have brain fog, they get retinal damage because of the small vessels in the eyes. So it creates a lot of damage. It also creates a lot of inflammation. So what people don't understand is that when you have a spike in blood sugar, your insulin has to go up. The insulin is produced from your pancreas. And when you have a big carbohydrate meal, your sugar goes up in your blood, and then the insulin will follow, and it'll have to improve the sensitization of the cells, right? So it has to improve the cellular uptake of the sugar from the body, from the blood. So that's what insulin does. But if you take in too much sugar, what happens is your cells become resistant to the insulin. So it does not work as well, even though in the past it might have worked. But as you start to continually stress the body with excessive sugar, it does not work as well. So what happens with this is the blood will start to circulate, and the sugar will start to circulate in the blood. And then it glycates, or it basically adds a sugar to these end products, and creates damage, inflammation, and so forth. So today what we're going to talk about is insulin resistance, diabetes, and hypoglycemia. And all three of them can affect brain function, brain fog, cause inflammation, and then later on increase the risk of diabetes, as well as neurodegenerative changes. So insulin resistance, what is it? Basically, it's the person who, after having a heavy meal at night, will sit down on the couch and they will fall asleep. They will doze off. Or after a heavy meal, they go, you know what? I still want a bag of chips. I want some ice cream, right? They crave more sugar, okay? Those are the insulin-resistant individuals. And how do we determine that on a blood test? Typically, on a blood test, they'll do a fasting blood sugar, right? The first morning sugar, and it should be below 100. Ideally between 85 and 90 maybe, okay? However, the fasting glucose for an insulin-resistant individual is going to be 100 to 125, okay? So that's a snapshot in time. What is my sugar doing? The next test is something called hemoglobin A1C. The hemoglobin A1C will determine a 3-month average of blood sugar. So it tells you how much sugar you have taken in over a 3-month period of time versus a fasting blood sugar, which is just that 1 point in time. So if hemoglobin A1C exceeds 5.6 and goes up to about 6.0, then you may have insulin resistance. So insulin resistance is this: fasting blood sugar greater than 100 up to about 125, your hemoglobin A1C between 5.6 and 6.0, and then your total cholesterol will go up above 200, your triglycerides will go up over 100 or 110, your HDLs, quote unquote, good cholesterol, will fall below 40, and your LDLs will climb, right? Your LDLs will climb to above 110. Okay? So those are your basic markers. But symptoms also tells us a lot of information about what that person, because sometimes the blood test only includes a fasting blood sugar and doesn't include the hemoglobin A1C, and you can't tell if that person maybe have fasted more than 12 to 14 hours and all of a sudden their sugar is just under 100, right? So hemoglobin A1C is an important marker for that. When you have diabetes, your fasting blood sugar will climb above 125, right, and beyond, and your hemoglobin A1C, your 3-month average, will be greater than 6. Okay, so you're in that stage where you're like, oh, am I insulin resistant, pre-diabetic, or do I have diabetes, right? So those numbers above that will indicate that you may have diabetes. And also you'll still see, with the diabetes, you'll still see the cholesterol over 200, triglycerides over 100, HDLs below 40, and LDLs above 110. So those are the basic markers that you're going to see, right? And when you have these sugar problems, you're going to have some brain fog, cognitive changes. Your brain endurance will be worse, right? So you have to be able to recognize these symptoms so you can change it earlier on than later on where there's damage, okay? The other flip side to this is hypoglycemia. And a lot of people don't really talk about hypoglycemia, and the reason is a lot of people don't understand it, and two, they don't consider it, diabetes, and so they're not really worried about it. But there are a lot of women, in particular, who have hypoglycemia. Hypoglycemia are those individuals, if they miss a meal, they get angry, irritable, shaky, right? They get, I need to eat something now or I'm going to faint type of person, right? That Snickers commercial that says, have a Snickers and stop being more like a woman. Well, what they're trying to say is that when your blood sugar drops, your emotions will get in the way, right? It becomes irritable, angry, shaky, right? Emotional. All those things can happen with hypoglycemia in between meals. So if you skip, let's say, lunch altogether after having breakfast, after like an hour or two, you get really shaky and out of sorts. So it's very important to maintain blood sugar. So it's usually in women with a hypoglycemia. They usually also have low blood pressure. So your blood pressure will drop below 100 over 70. The other thing you'll see is also low adrenals. Like their cortisol levels are very, very poor. They don't have enough cortisol in their system. And the reason that happens is because when your blood sugar drops in your body, cortisol needs to come up in order to tell the liver to produce more sugar. So if you have this roller coaster ride of your blood sugar, right? Your blood sugar drops, cortisol goes up. You eat and it's a little bit better. And then you get this all day long of this up and down of your blood sugar, and then also up and down of your cortisol, and then up and down of insulin. Those things can become inflammatory, right? It causes inflammation. And every time those things happen, you're destroying your brain cells, right? You destroy it. You also damage tissue, right? And you stress out your adrenal glands. And it's very important to have your adrenals intact. So when we look at hypoglycemia, what do we look for in the blood test? Fasting blood sugar below 75. Hemoglobin A1C sometimes will be below 5. Something called lactate dehydrogenase, or LDH, will be below 140. And then we also look at some of the minerals like chloride, potassium, and sodium to see if there's any adrenal dysfunction. You can also do other things like an adrenal panel. You can use saliva and plot out what your cortisol levels are throughout the day. Invariably, the people who have low blood sugar tend to have low cortisol levels because they're burning their cortisol out. They're using so much of it during the day because their body's under stress because of blood sugar dysregulation. So things that are bad for the brain is abnormal control, right? Whether it's too high or too low of blood sugar, right? And then the inflammation that follows blood sugar management, right? If you're not managing your blood sugar and it's too high or too low, it causes inflammation, right? So the brain suffers. So in terms of looking at blood sugar and brain, it's a crucial part in terms of the brain health. One other thing I'd like to mention is when you look at diabetes, sometimes it's not just the intake of sugar, but you might have an autoimmune disease. There is something called an adult onset, right, diabetes, or latent onset diabetes. And what that is the pancreas was, or your pancreas where they produce insulin was just fine, but over time, you develop an autoimmune process in that area. So you can do antibody testing for that. What you do is you check for GAD65, isolate cell antibodies, or insulin or anti-insulin antibodies. So you can see if you have an autoimmune disease. So if you have an autoimmune disease, it's not just about, oh, I have to eat less sugar. It's about controlling the autoimmune process. So that can be managed with things like good fats and fish oil, glutathione, and vitamin D, and some other things, right? So you have to be able to manage the autoimmune process, because people who have autoimmune disease, their tendency to develop another autoimmune disease goes up significantly, right? So that, in a nutshell, is about blood sugar, or sugar in general, and how it affects brain function, and you need to be able to manage that. And you need to check the labs. You need to check to see you have these underlying lab markers. So it's very important that you do that. Okay? I'd like to thank everyone who signed up last week with us, and everyone who liked and shared the video. I really do appreciate that, and spread the word. And we'll see you back on the healthier side. We'll see you next Tuesday at 12:30 at our regular time.